Okay, hello, my name is Carol Flowers, and I'm here today to just talk about what a family nurse practitioner is. The purpose of this video is just to educate the general public about um, nurse practitioners and what they can do, and just answer some questions to give a little bit more knowledge to the public about what it is we do and who we are. So I have with me today Cassie Flowers and David Flowers. They've generously allowed me to interview them for the purpose of this video. Thank y'all for being here.
Good to be here.
You're welcome.
Okay, so like I said, we'll get started. So I'm going to ask y'all some questions about family nurse practitioners. So Cassie, what do you think a family nurse practitioner is?
I think a family nurse practitioner is someone who's professionally trained to do acute diagnose acute illnesses and then treat them.
That's good. You're right. So a family nurse practitioner is a nurse who has advanced training, and they integrate those clinical skills of nursing with the clinical skills in medicine to manage and take care of patients in a primary care setting or in an acute care setting. So that's what a family nurse practitioner is. Good. So a lot of people might wonder, can family nurse practitioners diagnose illnesses? David, what do you think?
Yes.
Yes, you're correct. So family nurse practitioners can obtain histories, and they can do physical exams, and they can use that to diagnose and develop treatment plans for their patients. All right, so Cassie, do you think that a family nurse practitioner can manage acute and chronic illnesses?
I do.
Thank you. You're right. Nurse practitioners can take care of a wide variety of different acute and chronic illnesses, such as respiratory infections, sinus infections. They can manage chronic conditions such as asthma, COPD, diabetes, hypertension. So you're absolutely right. Nurse practitioners can manage any kind of acute or chronic illness that someone may come into the clinic experiencing. So let's talk about overall, what do you think a family nurse practitioner does, David?
Renders medical care or assistance to people in need.
Yes.
Rounds for the doctors, writes prescriptions.
You're right. So a family nurse practitioner can assess, they can diagnose, they can identify patient outcomes, they can plan, they can implement those outcomes, they evaluate those plans to make sure they're working, and they teach and promote health maintenance to their patients. Very good. So Cassie, do you feel like a family nurse practitioner has do you feel like they have to collaborate with a physician?
I don't think they have to collaborate because they can be what's the word? They can take on patients on their own without having to have another doctor there.
Right. So family nurse practitioners can have independent practice. And again, this does depend on the state in which they practice, if they have full authority, Practice Act, or if they are restricted. So if you are in a state with full authority, then you do not have to collaborate, but some of them still do. However, it's not required. And in the state of Georgia, it is required to have a collaborating physician. And so therefore, you have to have a physician in order to practice in the state of Georgia. So again, it does depend on where you're practicing, but you definitely could hold your own clinic in certain states. So very good. David, do you think that a family nurse practitioner can diagnose or order diagnostic test?
Yes.
You're correct. So in a full practice authority state, nurse practitioners are trained and fully capable of ordering any kind of laboratory or diagnostic tests such as x-rays, MRIs, CTs, anything to diagnose and help them in their treatment plan. If you're in a restrictive state such as Georgia, you can still order these tests, but it does have to be under the permission and in the protocol that your collaborating physician allows you to do. So if your collaborating physician allows you to order such tests or labs, then you're allowed to do it. Very good. So next question that a lot of people in the public have is, can family nurse practitioners do simple office procedures, Cassie?
I think they can.
So you're correct. So family nurse practitioners can do simple office procedures, and it depends on the setting in which you're working, but a lot of nurse practitioners can do simple, they can do skin biopsies, they can remove moles or skin tags, they can do sutures or staples to open wounds, they can clean certain wounds, they can also do EKGs and interpret those EKGs. They can interpret chest x-rays. They can also do incision and drainage of abscesses. And depending on, the setting, like I said, they can also insert or remove certain contraceptives or do pap smears. They can do pulmonary function and spirometry readings. And so they can definitely provide some basic procedures within the clinic setting as a family nurse practitioner. And so another question that the public will ask often is, can you write prescriptions? Because, when you go to the doctor, one of the main things that they're there for is to get their medications. And so oftentimes they ask, well, can family nurse practitioners prescribe? David, do you think that family nurse practitioners can prescribe, and do you think they can prescribe narcotics?
Yes.
Yes. So family nurse practitioners, they are definitely able to prescribe your medications to you. It depends on the state and the setting as to what medications they can prescribe. In a full practice authority state, nurse practitioners are able to prescribe Class 2 medications, which are regulated by the government if they have their DEA license. And in order to get a DEA license in those states, they have to meet certain regulations and, certifications. But certainly in a full practice state, they can prescribe level 2 and 3, 4, and 5 scheduled drugs. So in a restrictive state such as Georgia, nurse practitioners cannot obtain a DEA license. They cannot prescribe Class 2 scheduled drugs, which are your narcotics and some of your mental health medications such as Ritalin and such, but they can, with the permission and under the protocol of their collaborating physician, they can prescribe Class 3, 4, and 5 medications. So most of the medications that you would need would be able to be prescribed by your nurse practitioner. And then if you needed any of controlled medications, they would just be signed off by the collaborating physician within that clinic. So very good. So Cassie, another question. Do you think that nurse practitioners can bill for their services?
Like charge?
Mhm.
Yeah, Yeah.
Correct. So, nurse practitioners achieve the knowledge um, and the ability to learn the healthcare system's financing and reimbursement systems. They are able to bill and code for their services rendered. And so this is so that they can provide cost-effective care, which is one of the main positives to having nurse practitioners in the healthcare setting, is that they are able to provide more cost-efficient health care. All right, so a lot of people will go into a clinic and they will say, hey, do you mind being seen by the nurse practitioner or the physician's assistant? And most people don't know the difference between a nurse practitioner and a physician assistant. And so, David, what do you think the difference between a nurse practitioner and a physician's assistant or a PA is?
I have no idea. I mean, they're both pretty high up there. I mean, I think they both have to have a master's degree, if I'm not mistaken. But I mean, I really have no idea what their limitations of either one are.
Okay, so both nurse practitioners and physician's assistants are both advanced practice providers, like you said. And each group evaluates and treats patients. So you may encounter either one of these if you were to go into a clinic setting, but they hold different practice theories and they practice under different models. So the main difference is the nurse practitioners train under the nursing model, and they hold an undergraduate degree in nursing, and they also can advance that degree to a master's or even a doctorate level of education. Nurse practitioners also can specialize, and they can go into adult gerio or women's health or family practice. So they when they're going through their training in school, they specialize within that population. So PAs, on the other hand, their education is based off of a medical model, and so and they also receive generalist training, so they can go into any setting after they come out of school. And only 95% of them hold a master's degree or lower. Most of them are masters, but there's some programs that don't require a master's, and there's no ability at this time to reach the doctorate level under the PA environment. So, well, that's it. And I hope that you guys learned something about family nurse practitioners. So the purpose was just to, enlighten the population out there about nurse practitioners and answer some questions. And we appreciate your assistance with doing this video. And I hope y'all have a good day.
Goodbye.